Diabetes Disease by Hailey Getz and Kirstin Fudge, specifically type 2 diabetes. So what is diabetes? Diabetes is a disease that occurs when a person's blood glucose, which is also known as their blood sugar levels, are above the normal range. Blood glucose is the main source of energy for the body that is produced from the food you consume. Insulin is a hormone made by the pancreas, and this is the hormone that helps glucose from food get into your cells and be used for energy. Now, if a person has diabetes, the body doesn't make enough or any insulin or cannot use insulin properly, which affects the person's blood glucose levels and damages the body. There are a few risk factors that are involved with type 2 diabetes, and these risk factors include a person's family history. So if any person in their family had diabetes in the past, they can be more prone to developing the disease. A person's diet, if they're having a lot of inflammatory foods like processed sugars and fried foods, this can affect a person's weight, which is also a risk factor for diabetes. Their age, usually people who are later in life can develop diabetes through their diet, lifestyle, inactivity, not moving, being sedentary, being overweight or obese, which is another term for having excess fat in the abdomen. This is a big risk factor. Having a diet that is low in fiber and high in sugar, fat, and salt, also known as sodium. Smoking, engaging in low levels of physical activity, low sleep, high stress levels, and again, this can also be developed through your genetics and family history. So what are the different types of diabetes? The most common and prevalent type of diabetes are type 1, type 2, and gestational diabetes. Type 1 diabetes occurs when your body does not make insulin. It is usually diagnosed in children and young adults, but can appear at any age. People with this type need to take insulin every single day in order to stay alive because their body is unable to produce insulin. Type 2 diabetes is when the body does not make or use insulin well or properly. This can be developed at any age, and it is the most common type of diabetes. Gestational diabetes usually occurs in women who are pregnant and goes away after the baby is born. You have a greater chance of developing type 2 diabetes later in life if you have gestational diabetes during pregnancy. The less common types of diabetes include monogenic diabetes, which is an inherited form of diabetes, and cystic fibrosis related diabetes, which occurs when you have the cystic fibrosis disease. Causes of type 2 diabetes include cells in the body becoming resistant to insulin. This makes the pancreas make more insulin to make up for the cell resistance, and eventually the pancreas does not make enough insulin to keep up with the amount of glucose that is being taken in from the person's diet. Once again, a risk factor that we know is too much processed sugar in the diet, which disrupts blood glucose levels. Diagnosis of diabetes. To be diagnosed with diabetes, you must meet one of the following criteria. You must have symptoms of diabetes, which include increased thirst, increased urination, and unexplained weight loss, and a blood sugar level equal to or greater than 200 milligrams per deciliter. You must also have a fasting blood sugar level that is equal to or greater than 126 milligrams per deciliter. A fasted blood sugar test is taken after fasting for 8 hours. This means taking the test after having no water or no food for 8 hours. Have a 2-hour oral glucose tolerance test result that is equal to or more than 200 milligrams per deciliter, and have a hemoglobin A1C that is 6.5% or higher. People with diabetes disease can develop a plethora of health problems. This includes abnormally high blood glucose levels that can lead to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot issues. I currently have a roommate whose father has diabetes, type 2 diabetes, and he recently had eye surgery because he was starting to lose vision due to his diabetes, and he has also had to amputate one of his toes due to the diabetes disease as well. You can also develop cerebrovascular disease, coronary heart disease, diabetic nephropathy, eye damage, diabetic foot, peripheral arterial disease, and peripheral neuropathy.
So Hailey already talked about what diabetes is, the cause, diagnosis, and I'm going to focus more on the mechanism behind diabetes and how our body should function in a normal scenario and then in a scenario where the person has diabetes. So first off, to start, homeostasis is when blood sugar levels are between 70 and 110. If they drop below or raise above that, then that's when our pancreas, which is an organ located posteriorly or behind the stomach, will start making hormones, releasing hormones that will either cause our blood sugar to drop back down to normal levels or rise back to normal levels. So first we're going to talk about hypoglycemia, which is low blood sugar. And this picture is from our textbook, and it's a great example of how the body works to get back to homeostasis. So say the blood sugar drops to 50, our pancreas, the alpha cells on our pancreas are going to release glucagon, which is a hormone, and then glucagon being released from the pancreas is going to cause a couple different effects that are ultimately going to raise the blood sugar back up. So it inhibits body cells from taking up glucose from the blood, so and utilizing it for cellular respiration. So that process is going to stop to make sure that the blood glucose levels rise again. And it's also going to stimulate glycogenolysis, which is glycogen in the liver is broken down into glucose and released into the blood. So the stores of glucose in the liver as glycogen are going to be broken down into glucose so that they can be released back into the blood. And then also amino acids and free glycogen are going to be converted into glucose, and then that happens in the ER and it's going to be released into the blood. And then this will increase the blood glucose concentration levels and then ultimately get us back to homeostasis. And then once the blood sugar is back to a normal state, then the pancreas is going to stop releasing the glucagon so that our blood sugar doesn't continue to rise. So say that our blood sugar is too high. This is hyperglycemia, hypoglycemia, elevated blood glucose, and our beta cells in our pancreas are going to release insulin, and then this is going to cause a couple different effects. So this triggers body cells to take up glucose from the blood and utilize it for cellular respiration to hopefully get the blood glucose levels back down. It also inhibits glycogenolysis, which is the breaking down of glycogen from the liver into glucose. So it's going to stop that process so that we don't have more glucose going into our blood. And then it's also going to inhibit the amino acids and free glycerol from being broken down into glucose in the ER. So it's going to stop that process as well. And then once the blood glucose levels get back down to a normal concentration of about 90, then the pancreas is going to stop releasing insulin to make sure that our blood glucose levels don't keep falling. And so we get this homeostasis. So it's important to note that not all cells in our body require insulin to uptake glucose, but muscle cells involved in cellular respiration do, and so do fat cells. So this picture over here shows how insulin activates a series of biochemical reactions that allow for glucose transporters to move to the cell membrane. So as you can see here, GLUT4 moves to the cell membrane, and then it allows for glucose to enter the cell. So glucose transporters move to the cell membrane, and then they are able to transport the glucose into our body cells, such as muscle cells and fat cells. And in the process of type 2 diabetes, glucose enters the bloodstream from the intestine. Insulin also enters in, so they're both entering in. And in a healthy individual, the balance of insulin and glucose circulates through the blood, and then insulin binds to a cell, such as our muscle cells, and then insulin opens up the cell to glucose, which is the GLUT4 transporter is able to transport the glucose from in the bloodstream to inside the cell, and then it is able to be used for fuel. But in the process of type 2 diabetes, glucose and insulin are still entering the bloodstream, but insulin resistance, glucose can't enter the cells efficiently or effectively. So too much is in circulation. So too much glucose and insulin is in circulation. And the cells don't respond to the insulin, and then the cell can't open up for glucose to enter and be used for fuel. And this is the process of insulin resistance. The pancreas will secrete more insulin to make up for the cell resistance. So it keeps on making more to try and get the cells to open up and use the glucose for fuel. But eventually the pancreas doesn't make enough insulin to keep up with the amount that's in the bloodstream. And then that's when a person gets type 2 diabetes. Their blood sugar is so high and the insulin is no longer being produced in enough quantities to transfer the glucose from the blood into our cells to be used. And then this leads to a number of signs and symptoms, and I'm going to talk about that next. So this leads to extreme thirst, excessive urination, blurry vision, being constantly hungry because the glucose in your blood is not being taken up by the cells, and that's not being converted and used for energy. You're going to be tired because you don't have any energy, weight loss, numbness and tingling in the hands and feet, slow healing wounds, and then frequent infections. All of these signs and symptoms are due to having very high blood sugar. It's really not sustainable for anyone. Homeostasis is important. That's why we have glucagon and insulin to either bring up the blood sugar or lower it. And in type 2 diabetes, individuals cannot lower down their blood sugar, and this leads to a number of health problems. So I'll talk about the treatments next. So for type 2 diabetes, this is caused by usually having a poor diet, being overweight or obese, and then lacking exercise. So lifestyle changes such as exercising more, losing weight, and diet can really help with the extra blood glucose, the extra glucose that you're having in your blood. It's really important for people to monitor their blood glucose levels to see if they're falling too low or too high. And then using insulin therapy or oral medications to combat the insulin resistance in the cells and the high blood sugar that someone with type 2 diabetes is experiencing. And then oral medications have, there's a number of different ones. Some stimulate insulin production, inhibit glucose production from the liver, and then some can even block down the breakdown of carbohydrates into glucose, so it lowers the blood sugar, the overall blood sugar. So the prognosis, making lifestyle changes is really important for someone with type 2 diabetes. There's no cure for it. There are treatments, but there is no cure. It's a lifelong disease. And then if it's uncontrolled, if someone doesn't make lifestyle changes or they aren't taking the proper medication to combat the high blood sugar, then you can have serious complications. And then it's also the 7th leading cause of death in the United States due to all of the health complications from it if someone is not controlling their diabetes. So there are things and treatments that you can do to better your outcomes. It's never going to go completely away, but making those lifestyle changes and then using medication to lower your blood sugar can help prevent any of the life-threatening or serious health problems that can happen.
All right, and that concludes our presentation on type 2 diabetes. Thank you so much for listening, and I hope you learned a little bit about the disease, the risk factors, diagnosis, mechanisms, and prognosis that come along with developing type 2 diabetes. And once again, thank you so much.